little deal there. Now, what I want you to do is take the page before it and put TNM, just like I have it here, TNM. Make sure it's vertical. And on the other side of the page, just put grading in one area, go down to the bottom and put staging. I'm going to show you how this goes. Okay, now, so you got this grading and staging crap, right? TNM. Tumor, nodes, mets. This is basically staging the cancer. It is telling you if it's spread. Okay, so a TNM is a system of staging and kind of really talking about if it's spread. So cancer attacks an organ, spreads in the bloodstream. The blood is carried to a lymph node. Remember the little chains in your books when you had biology and anatomy? The little chains, some little circles. Well, the blood carries the cancer to the little chains. Cancer is spread through your body through lymph nodes. And then the lymph nodes literally keep it going. There's lots of immune response, but nothing really exciting happening, but they may be enlarged. And then, after a while, we need a new source of blood and sugar, so we break a little piece away and go travel to another organ. Now, the meds. You had to know the 5 most common places for meds. Bone, brain, liver, lung, and lymph. Those are the 5 most common places for metastasis or spreading to another organ. Typically, the organ that it spreads to is nearby. So if I have pancreatic cancer, you better believe it'll be in my liver. It's whatever's nearby, usually. Now, you know how this goes. Patients are tested every 6 months for where did it spread, usually with a PET scan. PET, all capital letters, PET scan. We're going to give it to them every 6 months to see if it's spread. After a 5-year survival rate, we say, ooh, thank God it didn't spread, you know. So when you hear survival rate, it's 5 years. 5-year survival rate, oh good, it didn't spread or whatever it did, okay? And if it did, it didn't go nowhere else. All right? So when I look at this list, I'm very, very seasoned about this, and you should be too. In my patients who have survived their cancer, or are surviving their cancer, because it may be currently going on, they haven't got to the 5-year yet. If they called me and said, or either just mentioned it in the visit, that their back hurts, boom, it spread to the bone. Because any back pain, new onset back pain in a previous cancer patient is bone cancer until proven that it's not. I'm never disappointed. I'm almost always right on that. And I'm so very happy I didn't ignore it and say, oh, honey, you're working too much. You know how nurses are, because I have so many nurses as patients. You guys work too hard, live too much. No, I never said that. I assumed it was cancer until I proved it wasn't. Because why does your back hurt all of a sudden? You've been a nurse for 20 years. Okay, so think it through, y'all. Back pain, number 1 classic hallmark sign in somebody whose cancer has spread to bone. For the brain, all of a sudden they started having seizures, or all of a sudden they started having headaches. Headaches are getting worse by the minute. Every day they wake up to it, go to bed with it. That would be spreading to the brain. Seizures for sure. My daughter's got a beloved friend. Out the blue, started having seizures. Right here. Liver. This one is the worst. One of the worst, I should say. Lung is the worst. But liver is one of the worst too, because my God, this is very, very, very advanced, right? By the time it hits the liver, you're going to be jaundiced and clay-colored stools and itching and hot mess. So just think liver, jaundice, clay-colored stools, foamy urine, long urine, you know what it is, shortness of breath, hemoptysis, coughing, blah, blah, blah. And then there's lymph nodes, lymph system, that's what everything goes through there a lot of times. So if a patient gets diagnosed and already they have some mets, so we see T1 or 2, 3 or 4, it goes up to 4, but the bigger the number, the bigger the tumor, size of the tumor, T, size. Nodes, lymph nodes. How many nodes are positive, right? 2 lymph node chains, 1, none, 0. You remember the girl with the normal mammogram? That T was 1, the N was 0. All right, hadn't gone anywhere. Hadn't gone any lymph nodes at all. All right, so when we know it's in the lymph nodes, it has potential to spread. We got to take those lymph nodes out. And that's really bad. Mets. When we're talking about mets, we're talking about spread to other organs. This may be a 1 or 2 or whatever. Whatever it is, you need chemo and radiation. If there's mets or positive nodes, you need chemo and radiation. If it's just nodes, no mets, you probably just need chemo. It just depends on the cancer. One thing's for sure, chemo is needed if the N or the M is positive. Remember what radiation is for. Radiation prevents recurrence. So radiation prevents recurrence. Okay? All right. Grading, which I told you to write down real quick. Last thing on this page you need to define is grading. The higher the grade, the worse the cancer. It means in a grade 4, because a lot of you hear that, and you should know that that's really bad. It means that the cancer is poorly, please use these words, differentiated. Poorly differentiated. In other words, the borders are indistinct. You don't even see no real sharp borders. The nuclei or the center, remember that from science? Nuclei is huge. I can see cervical cancer on my microscope when it's advanced. The nuclei are so huge. I can tell something right here. So poor differentiation or poorly differentiated, grade 4, huge nuclei. It's really, really, really bad. Okay. Okay. Now, if you turn to your page, to the one, it might be the next page, I don't know. Yep, it's the very next page. At the top of that page, put chemo. Because that's what we're talking about, chemo. With the patient that has chemo, and when we look at this page, the whole page represents chemo, but I want to point out how typical treatment of cancer goes. So if you can just write this at the very bottom. Treatment for cancer, generally, 100% of the time, is going to start with surgery. If we need to go further, chemo, maybe radiation. Okay, so you can put this in a long list of stuff, either up and down or going across. So if we need to do, if we're treating the cancer, surgery, chemo, radiation, then there's something queer called adjuvant therapy. It's whatever you added to the surgery, adjuvant therapy. Lately, we have seen immunotherapy, which is just simply amazing. I want you to put for immunotherapy, stem cell transplant. Stem cell transplant for immunotherapy. We may use hormones, meds, whatever. Targeted therapy, whatever. The bottom line is the ones I wrote. Okay, so you get it. Now this whole sheet is chemo. So we need to start off understanding that chemo affects 4 body systems. It affects integumentary, GI, reproductive, and the worst one, hematology. The bone marrow at the top on the left-hand side, I want you to write this fancy $4 word, myelosuppression, equals ant. And you guys know ant. The bone marrow with the cross over it, with the X over it, myelosuppression equals ant. What's A? Anemia. What's N? Neutropenia. What's T? Thrombocytopenia. Together, collectively, they're called pancytopenia. It's the number 1 reason patients die, right? Infection. So it's the number 1 reason patients die, this shit here. Okay? Because all your counts are down. Now, when you go for your little chemo, what'd I tell you? The nurse is supposed to hang the fluids. She's supposed to throw some Zofran up there. She's supposed to go ahead on, get that chemo. Didn't I tell you she's supposed to be certified before she can hang it? Yes. Make sure you know it. She's supposed to get 2 nurses to check it. Remember that? High alert drug. She's supposed to put on her little nightgown or PPE. Personal protective equipment, because it can absorb through her skin and hurt her. Okay, so you better have that down. Certified, 2 nurses, PPE. All right. Now, before she can hang the chemo, she had to have drawn blood when she started her IV. And what blood did she send off, toe-to-toe? What did she send off? Checking all this here stuff. What did she send off? CBC with nurses diff. If I said neutropenia, you better believe it was a diff in there somewhere. Okay, so CBC with diff she sent off. Differential always gives you an idea of infection, doesn't it? Neutrophils, you know, neutropenia, that one. Okay, so you had to send that off because your CBC is going to have your hematocrit, your hemoglobin, your platelets, your white blood count, all of this. All right. Now, she also had to send some chemistries off, huh? Because she wants to make sure that you're not sitting up here with tumor lysis syndrome. Yeah, tumor lysis syndrome. You're going to put that somewhere on the page extra. I don't care where. It's just TLS. TLS is a chemotherapy complication.